In this video, I'm going to talk to you about medical renal biopsies, which is a procedure that helps us understand and manage certain kidney conditions. So your doctor, your nephrologist recommended a medical renal biopsy or medical kidney biopsy. You might be wondering what it involves, why it's necessary, and what can you expect. So a kidney biopsy is when we take a sample of one of the kidneys, the right or the left. It doesn't usually matter which side we take the sample from, as long as they look the same. Sometimes if one kidney is very small and the other kidney seems to be doing most of the work, we actually want to take the sample from the kidney that is doing the work, since that's the one that we want to preserve. So this is a procedure that's usually recommended by a kidney specialist called a nephrologist. They usually recommend when you have a rapidly progressing renal failure and they can't figure out why, or you have chronic kidney disease but then it's suddenly started getting worse. Sometimes it can also be recommended when they find protein in your urine and you have something called nephrotic syndrome. And usually they have already done a battery of tests. And even with all these tests, they still cannot figure out what's causing the problem. And in these cases, we're usually looking for some type of autoimmune disease when your own immune system is attacking your kidneys, and that can be treated with the steroids and hopefully prevent kidney failure in the future. Sometimes it can also be recommended by a rheumatologist that is treating your lupus and he wants to see if the lupus is attacking the kidney. That would certainly change the treatment. Again, when you come to somebody like me who performs the biopsy, usually you have a recommendation by either a kidney doctor or a rheumatologist. And my job is just to take a good sample so they can analyze and find the answer. Now let me talk to you about how the procedure is actually done. The renal biopsy is typically done under imaging guidance. In our practice, we may use ultrasound, or we may use a CT scan, or we may even use both to ensure accuracy and also safety, because we want to avoid any blood vessels that could cause bleeding. Usually the biopsy also has to be done in the cortex of the kidney, which is the outermost surface of the kidney, otherwise it's not going to be helpful. When you do the procedure, usually the patient is lying on their bellies. And that's because most often we'll access the kidney from your back. We usually give you what's called a moderate sedation or twilight sedation. That's when we give you medicine in the IV to make sure you're comfortable. It does not have the same risks of general anesthesia and does not require an endotracheal tube, for example. So the patients are sedated, but they are arousable, and usually they recover pretty quickly. It's similar to what people get when they get, for example, a colonoscopy. Before starting the procedure, we'll also give you local anesthetic to numb the area, and if you're somewhat awake, you would feel minimal discomfort. Once the area is numb and we're sure you're comfortable, we then introduce a special needle that we put all the way to the kidney under the imaging guidance, and we're extremely precise. And through this needle, we can take the sample using something called a core biopsy needle. The core biopsy needle is introduced through the needle guide, and then we basically take a little bite of the tissue, which is enough to make the diagnosis. Once we're done with the biopsy, then we just remove the needle, and essentially the whole procedure is done. So in good hands, the whole process takes about 10 minutes and is generally not painful. After the biopsy, we will apply a surgical glue to the area and observe you in the recovery area. If you're doing okay after the observation period, then you can go home. It is usually very simple, but it's important to know that there is a small risk of a bleeding complication with this procedure. Bleeding complications are very rare, but they happen. They could require you to stay overnight. They could require to have a blood transfusion, especially if your hemoglobin is already low, and could even require another procedure called an angiogram to stop the bleeding. Again, in our practice, we do hundreds of medical renal biopsies in a year, and the risk of the complication is 1% or less. If you're curious, an angiogram is a procedure that we inject a little spaghetti type of tube in your groin, and then we can navigate under x-rays to the kidney, and we can find this small blood vessel that is causing the bleeding, so we can block it. After the procedure, you'll be able to take a shower the same day of the procedure or next day if it's better for you. It's normal to have some mild soreness at the biopsy site, but over-the-counter pain medication should be enough for that. Obviously, if you notice blood in the urine or significant pain or fever, you should contact us right away. Finally, let's talk about what happens after the biopsy is done. So the sample is then carefully labeled, and then we send to an extremely specialized lab. In our case, we send all our biopsies to Stanford, where they have super specialists. They examine and provide an extremely detailed report. They do all sorts of complicated things, including immunofluorescence or electron microscopy, and it's a very detailed report. You will need to follow up with your kidney doctor to get the results and discuss the treatment plan. But of course, if you have any questions or concerns about the procedure, you need to reach out to our office.